What role can mass media play in helping improve people's health? Well, in Burkina Faso, 1 child in 10 doesn't survive to their 5th birthday. But a new study suggests that child mortality may be on the way down. Thanks to a new health campaign, radio stations in some parts of the country have been broadcasting simple advice on everything from breastfeeding to malaria. Radio is also being used to inform people on the Ebola virus throughout West Africa. More on that in a moment. But first, this report from the BBC's Tamsin Ford, who's been to the town of Bogandi, northeast of the capital, Ouagadougou.
6 years ago, the brother of these children fell sick. They called the pastor and prayed. They used traditional medicine. But 6-year-old Defreri never woke up from his fever. No one, not even the nurses, knew why he died.
I thought it was what we call the maize sickness. When the maize grows, the children pick it from the trees. Then they get the disease and need treatment. That's what I thought it was.
But it was nothing to do with their crops. It was malaria that killed him. 1 in 10 children in Burkina Faso die before they reach the age of 5. In rural areas, few have access to healthcare, and the dry, arid land brings in little money for hospital bills.
Child mortality in Burkina Faso is one of the highest in the world. First of all, there is malaria, which is the leading cause of child death and hospitalization in Burkina. That's followed by diarrhea, and then thirdly, respiratory disease.
And this is where the radio comes in. A new campaign broadcasting targeted health messages to do with things like the importance of breastfeeding or malaria treatment are starting to change people's behaviour. And it's thought this behaviour change could help reduce the country's infant mortality rate. Radio Jawampo is one of 7 community radio stations broadcasting adverts, dramas and live programming to do with child health. Regions that aren't covered by the radio campaign are also monitored. Initial results show families living in the broadcast zones are beginning to change how they look after their children. Simple things like giving them more fluids when they have diarrhea.
This trial is an opportunity to prove to funders, to policy leaders, that mass media is one of the most effective ways to reduce that mortality. So our goal is not to prove that we have a great way of doing community radio. We believe that, but our goal is to reduce mortality.
The radio has opened my eyes, especially when they talk about malaria, hygiene and nutrition. That's why we've changed the way we do things. It's like a school for me. The radio is my teacher.
3/4 of the population listens to the radio every day. DMI claims a media campaign changing people's behaviour could be a cheaper way to improve a population's health. Tamsin Ford, BBC News, Bogandi, Burkina Faso.
Incredible, the power of radio. Well, with me now is Roy Head, CEO of Development Media International, and BBC Health correspondent Smita Mundasad. Thank you both for joining us here on Impact. Roy, I'll start with you because you've been quite instrumental and key in this whole campaign. Just tell me what health messages you wanted to get out there.
Well, the big killers are diarrhea, malaria, pneumonia. So really we want people to recognise the signs of those diseases and then also just protect themselves in ways that can prevent illness, like breastfeeding within an hour of birth, breastfeeding exclusively, washing your hands, that sort of thing.
I mean, the idea is a brilliant one, and obviously it's being spread across these regions, but is it hitting home?
Well, the mid-term result, we're really aiming to reduce mortality. We're aiming to be able to prove definitively that these sort of campaigns can actually reduce death. So it's a proper scientific trial with controls. What we've got so far is not the data on mortality, but we've got it on behaviours, and it does show that behaviours are changing. And in 6 or 7 of our key 10 messages, we've got, changes in behaviour at between 8 and 23% better than the control group. So we're quite happy with that.
So what change in behaviour? I mean, are things like washing your hands and hygiene changing?
the things that are really changing, which is a surprise to us, what we expected was that things which were done at home, like hand washing, like breastfeeding, those would be the easy changes, and things that required people to actually go out and do things like, get drugs or get their child checked for pneumonia. We thought they would be harder behaviour changes. In actual fact, the reverse has been the case. People are really willing to change in an emergency. So when the child's got fast breathing, which is a sign of pneumonia, they go out there, and then we've got quite extraordinary changes in the number of people going to get treatment for pneumonia. What's been slower to change are things like hand washing, things like exclusive breastfeeding, things that have to be done several times a day, every day, and that's just hard for people.
So when you look at these preliminary results then, will you start to change the way you're doing the campaign, just to change that behaviour then?
Yeah, we've analysed the results and we look at what's really working. So we're going with our strengths, if you like. But at the same time, we have to also balance that with what the big killers are. So, things like malaria, nobody who's trying to reduce child deaths in Burkina Faso can afford to ignore malaria. So we'll tweak the results, and we have tweaked the campaign according to that, to what we've learned.
Well, we're looking at something quite similar on Ebola. And Smita, I'd like to bring you in now, because World Service Radio has quite a similar program on Ebola, doesn't it?
We very recently launched a dedicated programme on Ebola called News About Ebola. It goes out every day at 1950 GMT across the world. And what we realised as the Ebola crisis unfolded, sadly, is that it's not just a health issue, it's an economic issue, it's a political issue, and it's really affecting people's traditions. So we wanted to look at it from all these points of view. And there is so much news rapidly changing every day, so it gives us an opportunity to look at that, to question the politicians about the aid that's coming in, to talk to people in the affected countries and find out their experiences, and to really do some analysis to get more out about Ebola.
Why are you finding that radio, for example, is the effective way to do that, rather than, say, social media?
Radio is the mainstay, the main type of media that's used in these regions, and particularly in the rural areas, electricity is still poor in its supply, and so radio is the best way to really get messages across. And we've had really good listener response. We're getting a lot of questions, and some on social media, asking us more questions about exactly what Ebola is, how you get it, and so we're looking into all of those.
And just briefly, what about social media, for example? Because there are a lot of rumours and conspiracy theories swirling around. I mean, how do they contain that?
There are lots of rumours. We've heard one that apparently drinking salt water can somehow rid you of the virus, and the World Health Organization has said actually that 2 people in Nigeria actually died from doing this kind of practice. So it's really important that other media get out there and explain that these myths simply aren't true.
Okay, Smita, Roy, thank you very much both for joining us.